Thank you, Robin, and thank you to all of you for joining us today for this Beyond Your Ears webinar. HLAA is a nationwide community of support offering connection, education, advocacy, and empowering millions of people with and who are at risk of hearing loss. Joining HLAA is often described as life-changing, as it helps people learn to thrive with hearing loss. So if you're new to HLAA, please scan this code or go to hearingloss.org to learn more about our mission and how you might get involved. If you're here today, you likely already know that hearing loss has a significant impact on your everyday life, and it doesn't stop with your ears. Even what you might consider a small hearing loss or a mild hearing loss can affect your relationships with your family and friends, your job performance, your self-confidence, and even your personality. So we're going to dig into this today. The emotional side of hearing loss was the subject of our Research Symposium at last year's 2024 convention in Phoenix. Our research symposiums are supported by a grant from the National Institute on Deafness and Other Communication Disorders at the National Institutes of Health. The response was overwhelmingly positive and supportive about this topic, so we decided to offer more, and here we are today. This month, we're promoting our Beyond Your Ears campaign to help raise awareness and offer resources to help people just like you tuning in today. It's running in conjunction with Better Hearing and Mental Health Awareness Month, which are also in May. Check out our new Beyond Your Ears webpage filled with resources and articles on the topic, including articles by two of our panelists joining us today. Hopefully, you'll learn more about how hearing loss can affect your personality, your level of self-confidence. It can cause anxiety, and we've heard from people even depression. It can affect your relationships and your work. So learn more, scan the code, know that you're not alone in these feelings. Today's webinar continues the discussion about the impact that hearing loss can have on a person's life with three expert panelists. One of our guests today moderated our research symposium last year on the topic. Dr. Ivette Cejas is the Director of Family Support Services and Professor in the Department of Otolaryngology and Psychology at the University of Miami Miller School of Medicine. Dr. Cejas wrote an article on this topic in the winter issue of Hearing Life magazine. Welcome, Ivette.
Hi, thank you, everybody. And I'm super honored to be part of this panelist and share some of the, I'm sure, unique stories I've heard from both patients and families, but also hopefully tie in some information related to the research that I've done about the importance of hearing loss, access to technology, access to services that we know really can make a difference in terms of your quality of life and, more importantly, your mental health. So I'm excited to hear some of the questions and get everybody engaged so that we can make the right choice. And as with everything, early identification, early intervention on any area is really going to be the key to your success and the key to your overall well-being.
Thank you, Ivette. The next panelist is a member of HLAA and a former HLAA board of director. It's Ibrahim Dabo. Mr. Dabo is commissioner for the Georgia Commission for the Deaf or Hard of Hearing and a hearing health advocate. He will be a panelist at this year's 2025 Research Symposium on Hearing Loss Stigma, another related topic. Ib, tell us about yourself.
Thank you, Barbara. Hi, everyone. I am Ibrahim Dabo. I am a husband and the proud father of three beautiful young children. My journey with hearing loss began over a decade ago when I was diagnosed with bilateral hearing loss. That was the first time I actually heard about hearing loss. The diagnosis came as a complete shock to me, and I didn't know what it meant for my future. That was followed by 7 years of silent struggle, marked by confusion, isolation, and the feeling of giving up on my dreams, and also the emotional weight of stigma. I didn't know where to turn or how to talk about it. My sense of identity was shaken. eventually I discovered the HLA, and that was the biggest discovery for me of a lifetime. That's how it felt. And this is a community that not only understood what I was going through, but reminded me that I didn't have to walk this journey alone. I found hope, I found support, and a renewed sense of purpose. So I'm really excited about this conversation today. It's something that's deeply personal to me, a wider impact of hearing loss, and I am looking forward to hearing and to share as well with you all. Thank you.
Thank you, Eve. And our third panelist is an HLAA member from our Los Angeles chapter. Dr. Allison Freeman is a clinical psychologist who has hearing loss herself. Dr. Freeman is at the California State University at Northridge, and she's also in private practice. She wrote an article on this topic for us in the latest spring issue of Hearing Life magazine. Welcome, Allison, and tell us a little bit about yourself.
Thank you, Barbara. I echo what Ivette said. It's an absolute privilege to be here. I'm excited to be here, and I'm particularly excited to hear about the questions that people have. Of course, we're not going to be able to get to all of them. A little bit about me. I was born as a prematurely born baby with a moderate hearing loss. They didn't know why. And now I have a profound loss. And one of my favorite topics is us going back and forth between the deaf community and the hard of hearing community. I will say that I was very excited. I'm an long time member. I actually met Rocky Stone, who was an absolute mentor for me. I thought, oh my goodness, if he was a CIA agent with hearing loss, then I can do it as well. And I was, in college. So I have started a number of our mental health service clinics, and I'm at Northridge. I love working with students, K through 12 and in colleges. And I think I've said enough. So thank you for all being here, and look forward to the questions.
Thank you, Allison. Allison referenced the founder of our organization, HLAA, Rocky Stone, who had a profound hearing loss and was a CIA agent and had quite a successful career. So thank you for bringing that up. We have new people who might not have realized our beginnings. And 45 years later, we are here today offering these important topics free to the public, whoever wants to join in. Ivette, Dr. Cejas at the University of Miami Miller School of Medicine, why don't I pose the first question to you? That'll get us started. What can a person with hearing loss do to prevent the depression and feelings of isolation that's often associated with hearing loss?
Yeah, that's a great question. And because I also work with pediatrics, is one of the questions that parents love to ask of how can we be preventative in some of these areas? The first thing is, I think, self-awareness. It is accepting the feelings and the thoughts that cross through our mind. It is realizing that while many of us want to have superpowers, we don't all really have them. And so it's okay to fluctuate in terms of your feelings. But if you are having consistent thoughts, if you are noticing that maybe your hearing is changing and that something might be going on, my first recommendation is always go ahead and speak to someone. So for children and families, that might be start talking to your pediatrician, talk to your PCP. But the next step should be, right, go to an audiology or an otology clinic, figure out exactly what it is in terms of your understanding of your degree and severity of hearing loss. Knowledge is power. And so by understanding that, understanding the technology potential options that you might have and your choices, you're already putting you in a place where you could have a better understanding of what might be going on and the journey that might be in your path. And then, of course, if you're an individual that might be having some more feelings of anxiety, a lot of people might experience some social anxiety, not sure how to communicate in large groups, in open settings. Talk to your providers, your audiologists, your medical team, but don't be afraid to then make those connections with a mental health provider. That could be a counselor, that could be a psychologist like myself and Dr. Freeman, but start making those connections and build your community, which could be through organizations like HLAA. It could be community in terms of patients that are being seen at your same clinic, or it could just be church, friends. Find that community because that will make the key difference.
Thank you, Yvette. That is really solid advice. And I'd like to pitch this next question to Eve because, Eve, you mentioned the word stigma and how you didn't even know what hearing loss was. And I knew you grew up in another country. And can you talk about the role that stigma played in your hearing loss journey? And when you found out you had hearing loss, what are some of the emotions that were related to that?
Yeah, that's a very important question. At first, I didn't know how to respond to it. I did not know. I felt the feeling of, well, first of all, I felt very sad. I felt lost because obviously that was the first time I experienced or even heard about hearing loss, right? And the feeling of isolation, because all of a sudden I was thinking about who are the people who might judge me, right? And this is not the first time I have experienced loss. I have lost family members, a dad since I was when I was 3 years old, and growing up by the age of 14, I lost others that I counted as father figures in my life. The difference that I got to experience was that when you lose something or you lose a loved one, the expectation generally is that people are going to show love and people are going to care for you in different ways. In this context here, the feeling was a feeling of being judged, right? I had those feelings of feeling inadequate, feeling like no one would understand what I'm experiencing, and just keeping it all to myself, right? And so that was a big challenge. And one of the things I realized over time was that it had to start with me. I often say that it has to start with me. The work really has to start on the inside. And it's a journey. It's a journey that it took some time to get over that, but it's a journey starting within myself and saying, this is not something that can hold me back from my dreams, even though I felt like it was giving up on my dreams. But I learned over time that once I discovered who I am, hearing loss aside, stigma aside, it reminded me of who I am. The people that I connected with through the HLAA, that was a powerful community. I discovered the HLAA. I was like, whoa, because for 7 years, I felt like I was all alone. I did not see anyone who experienced hearing loss. And, the first HLA convention that I attended, hundreds of people with hearing loss, I could relate, I could connect, I could hear their stories. And then I joined the HLA private Facebook group. I saw people sharing their stories and tips, and that really empowered me. It helped me to address a lot of the challenges that I was dealing with, stigma and the feelings of isolation, and knowing that I was not alone and that I still have a purpose and I can pursue it.
Eve, I'm really hearing that this community of support is important, and Yvette said the same thing. I'd like to build on what you just said with Allison Freeman. Eve, sadness, stigma, feeling like he couldn't live his dream. And I see from Eve, he's very resilient. He has some tools where he could think this through and bring himself out of it. But Allison, give us some tips. I mean, everybody might not be as resilient as Eve, of to develop this emotional resilience with hearing loss. What would advice that you could give? Could you talk about this?
Yeah, first of all, I want to echo several things about Ivette and Eve discussed. First of all, I've gone through a very similar journey as a child. It's hard of hearing. I was mainstream. I dealt a lot with depression and loneliness. And I went to see a therapist for the first time when I was 17 years old. And the therapist was with the John Tracy Clinic, and she really helped me to understand that my hearing loss doesn't define me. And I think that's really important, that whether or not you're dealing with hearing loss from a very young age or suddenly, you have to start to see yourself as being separate. You are a whole person, and the hearing loss is only a part of you. My favorite tip is dealing with what I wear my educator's hat, which is a very strong part of being able to advocate for yourself. Like Ivette said, knowledge is power. And my coping strategy growing up was to hide as much as possible and to block my way as much as possible. And that isn't the best way to deal with it. The best way to deal with it is to educate others, because I make an assumption that most people don't know about my hearing loss. So I empower not only myself, but the other person who I'm talking to. So that's probably my favorite tip, is to educate yourself as much as possible about your own hearing loss or your child's hearing loss, and to deal with the stigma of realizing that that stigma is entrenched in old thought, and it's our job to educate people to get rid of that stigma.
That's really insightful. You know, a person goes to an audiologist or a hearing healthcare specialist, and they learn they have a hearing loss, and then they're presented with options, you know, hearing aids, cochlear implants, assistive technology. Ivette, how can we better integrate the mental health issues into hearing care beyond the device?
Yeah, and this is something, that I'm happy to see that there are changes happening within the audiology and otology, community, where there are more mental health specialists or more psychologists that are really working with clinics to provide these services. But there's also a lot of work being done with doing screeners for patients, because mental health is important. And the first step, as since we've mentioned the word stigma, is to also not just reduce the stigma about hearing loss, it's reducing the stigma of mental health, which is a concern, for everybody. And so like practices, for example, like here at the University of Miami, while it took me a while to get the team on board, we implemented a mental health screener for everybody 12 years and up. And the reason we did that is because now we are not asking about these things when we see that there's a symptom, because that's too late. What we want to do is catch these things early, catch the individuals that maybe you are starting to feel a little more isolated. You're noticing changes in your sleep pattern. You're nervous about being in a public setting. And so one of the things we can do, and that I always ask, the hearing healthcare providers, is screen your patients. Don't be afraid to ask. They are more likely to talk to you as their audiologist, as their hearing, their HIS, their hearing aid instrument specialist, about their feelings and what's going on before they get to me. And so you could be that first step to that journey. And then the individuals with the mental health background then can offer strategies. So some of the things, Allison was mentioning is, yes, hearing loss is one component of yourself, but it's not all of you. So I have, the patients and the family say, let's talk about other things. What's important to you? What is going on? Is it that you're feeling anxious because you're worried about how to address a question? Is it because maybe you're having these negative thoughts and so we need to work on positive reframing? Is it, other things that maybe we need to work on deep breathing so when we feel nervous, because we all feel nervous, but not all of us know what to do in those situations. And so a lot can happen the moment that those dialogues begin to occur. And I find that the audiologists are usually the first ones to start hearing cues or patients and families asking for a little help and guidance. So they really, really have a crucial role in all of this.
So
You know,
what about, go ahead, Alice.
I would just like to really piggyback on that, because I've experienced it. I think that the reason why an educator's hat is so important is that people in the medical profession, as well as audiologists, as well as other professions, they don't really understand. And I've gotten too many clients coming in saying that they had no resources given to them or mental health or anything. So that's why it's so important that you arm yourself with questions like, well, can you give me any resources? Can you tell me about support groups? And one person who I noted in my article, she went 7 years after she was diagnosed as being deaf as a result of the operation. She wasn't given any resources at all by her otolaryngologist. And that's why I feel so passionate and echoing what Ivette is saying. And yeah, so thank you for bringing that up, Barbara.
So if we have, we all have family and friends, and we know they have hearing loss. They haven't taken the steps like
Right.
you have, like Eve and Allison have. And this is painful, and it's going to get more painful. How do we convince our loved ones to take that first step to treatment? Whoever wants to take it, take it. That's a big question.
I'll answer it because I can speak to personal experience. Sorry. When they realize the price they pay for bluffing is high, that's when they start to take the responsibility of telling people what they need. So for me, I was traveling in Europe, I was traveling in different places, I was bluffing, and I got myself in trouble, okay? Because I said yes too many times, or I missed important information. So one of the things I ask my clients is, would you rather be seen as stupid or hard of hearing? Simple as that, or would you rather be seen as being rude or hard of hearing? Because too often when I was bluffing, people would call me and they would take it personally that I wasn't responding. And that was a kind of a painful process for me to realize I had no intention of hurting your feelings. So that's one thing, and the other is just providing them with information that what they're going through isn't the same as our grandparents' sense of hearing loss with the
Right.
screening and the big Rockefeller microphones, So there's a lot more,
Exactly.
but
And
we're not.
often, thank you, Allison. Wearing a hearing aid is less conspicuous than
Yes.
appearing like you're not smart because you're not hearing something, or appearing you're aloof
Right.
and snobby. Eve, did you have something to add to that?
Yes, I would like to add. So, Barbara, one of the things I've heard you mention in the past is hearing health is part of overall health, and I do agree with that. And I would say, though, when I was diagnosed and I asked what are my options, and my audiologist informed me hearing aids, I was very reluctant. I went to the length of saying, is there a surgery that I can do to fix the hearing, even though I was terrified about surgery? But I was willing to go the extra mile to avoid wearing hearing aids. And I did not know what I did not know at the time, but with an open mind, I wanted to first give it a try and see what that experience would feel like. And I can tell you, the very first time I put on the hearing aids, just hearing the birds chirping for the first time, it made a big difference in my life. Just being in meetings and really understanding and being able to follow meetings, that took a lot of the stress, a lot of the pressure, and a lot of the feeling drained at the end of the day, because I got to learn that listening and trying to understand, it takes a lot of energy. That's what I experienced. But the relief in giving it a try. And I would say, we, I would I would encourage anyone to give it a try. And I would also say, be kind to yourself. You're not alone. There is a community. I was very hesitant the very first time, months, even years after I started wearing aids, walking down the street, I'm turning around, looking who is looking at me, if somebody is judging me because I had on hearing aids. But it goes back to what I mentioned. It starts with you, it starts with me. I had to work on the inside, the inner me. And so today I can walk across the street. It doesn't matter who is looking at me. I know that my purpose is bigger, and the hearing loss is it's not saying that you're little or you don't matter. It's actually demonstrate your strength, because a lot of the things that you are capable of, you have to believe on the inside that you can. And then the hearing support that you get, both in terms of whether it's hearing aid, in terms of a community like HLAA, you feel truly empowered to overcome that stigma, and your voice then becomes something powerful for others who can believe that they can do it. And in fact, they can do it.
That's those are inspirational words, Eve. Thank you. You're a person first, right? Who just happens to have hearing loss. We've had some questions come in about children, and I'd like to pivot to that. But before we do, Eve, you mentioned at the beginning that you
Yes.
have 3 children. How do they look at your hearing loss, or how do you present your hearing loss? I mean, it's got to impact somewhere in the family.
Yes, sure. It sure did. The biggest impact, it hit me first one time, because my daughter Gloria, she probably was about 2 or 3 years old, and in the middle of the night, we are listening, my wife Joy and I, the baby monitor. She woke up. I went to attend to her, and I did not have my hearing aids on at the time, and I thought that she was asking for maybe to just cover her properly or make her feel comfortable, and that's what I did. And so when I returned to the room, my wife mentioned to me that she was actually asking for something else. And the feeling, the way I felt like I had let my daughter down. And so one of the things that, on the inside, working on the inside of me, what can I do? How can I handle this going forward? Was educating her as she grows up what daddy is experiencing. And so sometimes when I used to carry her on my shoulder, she would tap my hearing aids and she would ask, Daddy, what is this? And I would explain to her it's a hearing aid that helps daddy understand you better when you speak. And one of the things I wanted to share is that with her was that, yes, daddy is experiencing hearing loss, but that doesn't impact the love that daddy has for you. And just taking those steps also teaches her and now her younger siblings how resilient they too can be in their journey in whatever challenges that they experience in life. And here is one of the beautiful things, Barbara. Probably she was about 4 years old. Her little brother was about 3 years old at the time. Sitting in the living room, I did not have my hearing aids on at the time. And she sensed that I was struggling to understand her little brother, Nyake. And I was surprised. She asked, Daddy, she's with this, childlike compassion and love. And she was like, Daddy, can I go get your hearing aids in the room? And I was like, yes, thank you. But a lot of emotions went through my mind. One, the fact that I had taken the time to educate her from a very early age what I'm going through. And she brought the hearing aids. I put the hearing aids on, and yes, I could understand what her brother was saying. And then we went to HLAA conventions. We did the work together, exposing them at a very early age. It just teaches them about compassion, love, resilience, and there's so much more to learn from that.
That's a beautiful story. I've met Eve's children. They're beautiful. And Eve, you're just so intuitive of how to
Thank
deal
you.
with them and how to deal with your hearing loss. You're a great example for all of us.
Thank you.
Ivette, how does hearing loss impact when a child has hearing loss? How does it impact their personality or their mental health? Is it different from adults?
Yeah, I mean, I often do think that it's different because most of these children have congenital hearing loss or they're born with hearing loss. So it is something that they've grown up with. And so while they still might have some struggles and some challenges, it's very different than an adult who's had hearing and then loses hearing. And so it's almost dealing with a grief process of their life changing. So for pediatrics, they still might have the same challenges about, interacting in a group, finding ways to fit in. I still see some of those questions, but the exact questions about hearing loss that I see adults have is different. Children are more focused on how are they being perceived? How are they being able to function? What group do they feel like they connect more with? Versus adults really, I think, struggle with just the perception of the loss as well. And just feeling that isolated and that they're not going to be able to do things like they used to. And so for children, they don't have that direct comparison.
Allison, do you have some strategies for parents of kids with hearing loss that can boost their confidence and help their development?
I think the major problem I see is that is the fight about how language is acquired. And so I think one of the most important things that parents can do is to provide as much access to language as possible, whether it's through captioning, whether it's through sign language, whatever. I know I grew up with parents who did not want to do sign language because they were afraid I would look different and I would not be accepted. So that's one of the challenges in working with parents, is to look at their own concerns and their own perceptions of what does it mean for their child. And of course, the parent, and my mother's also a therapist, we've talked about how parents go through their own grief process of not having the perfect child. So part of what you're asking for, the tips for the parents in dealing with the child, is also to look at themselves, you know. I think also to recognize and help parents learn the difference between behavior that's related to not hearing well versus typical developmental milestones. And so that's one reason why I think HLAA is so wonderful. It's a support group where people can say, hey, did your kid do that? Or, you know, something that therapist, one-on-one therapy just can't provide it, that group community experience. But at the same time, it's also important to learn what is typical behavior and what's not.
That's so important. And, you know, we see kids at our Walk for Hearing, and this is where I just was at the Westchester Walk, and a young woman now who with hearing loss came to her first walk. She's now in college, and she said, I never met another kid with hearing loss, because she was mainstreamed, and to just see that there was somebody else like her. And then the parents could talk with other parents. They had never met other parents with kids.
Correct.
And, you know, when we're talking about kids, you know, it's so broad because we're talking about the education system, we're
Right.
dealing with schools, we're dealing with IEPs. Ivette, are there a few key points that you could share with teachers or school administrations about the topic of hearing loss?
Yeah, and that's a great question. And here, at least at the University of Miami, and I know other pediatric practices are seeing this as an important area where they might actually have access to an educational specialist. So don't be afraid. If you're a parent, don't be afraid to ask if there's an educational specialist that could be the liaison between your clinic and school. Common things that we see is that children with hearing loss in various degrees do not have an IEP or an individualized education plan. Your child, if you have hearing loss, should qualify for that. And so that's one thing that we talk to families about. We talk about the importance of creating goals that might be communication based, but also that are maybe social or emotional. So I ask for all the educators, for even the parents, of saying, you know, we need to just not look about academics and communication. Yes, they're crucial and important, but there's more. And so schools and, you know, educators have that in their possession where they could have goals to help children learn how to advocate for themselves. How do you know what you don't know? How do you know how to ask what you didn't hear? How do you teach children the skill of normalizing some of these things? Of, you know, it's very simple to say, well, they could ask for somebody to repeat, but what about if they didn't realize that they missed it? Those are key factors that I definitely challenge some of, especially our educators in mainstream environments, of saying these kids might be functioning well. They might have normal communication, but that doesn't mean that they might not have challenges, that we still need to be that extra support. And so those are areas that I see more and more work being done, and I see good progress, but are definitely key areas that we need to be kind of more closely monitoring.
And we hear from parents, there's a big assumption on all of society's part. You put a hearing aid in your ear, oh, the person can hear. No big deal. So I would imagine a teacher sees a child with a hearing aid or cochlear implant and they think, oh, he or she is great. But what they don't realize, the background noise, so they
Yeah.
turn their face to the blackboard and all of a sudden the child can't get the visual cues.
Wow.
And just with family and friends, how often we have to remind them to speak clearly and face us. Can you imagine what a child goes through in school who doesn't want to stand out as being different? Would Allison, would you like to speak to that?
Yeah, and sometimes children will act out behaviorally because of that frustration. So it may not necessarily be the behavior that's the issue as much as looking at what preceded that whole event. And one thing I did forget to mention first about the whole issue of hearing aids is a challenging one, especially for those who have lost their hearing later, as they get older, because they're frustrated that they don't hear like the way they used to hear. But the same thing goes true with the cochlear implant. And I do think that parents sometimes forget that the children without the cochlear implant are actually deaf. So they're going to have feelings that are kind of mixed between being hard of hearing or deaf. There is a wonderful resource I want to point out. It's the American Society for Deaf Children. It's a great support group, as well as a lot of good information to support a lot of what you're talking about with IEPs and education. And again, very strong on advocacy. Parents have to continually advocate for their child. At the same time, it's teaching the child.
It's teaching them because when the children get to college, they don't have their parents as advocates anymore. They're
And I
really
can
on
speak
they're
to that.
they're really on their own. Go ahead, say some
Yeah,
things about
no. I can definitely speak to that. That the identity issues tend to be one of the strongest and most common things that college students come in for, as well as they feel like they're kind of being thrown into a big ocean and when they've been in a fishbowl. So there's a lot of adjustment to college and the real world. So I know
exactly.
we don't have time
Exactly.
for that, but absolutely the identity issues start to really emerge more in late adolescence, early adulthood that sometimes don't get addressed when they're younger. Yeah.
So, Eve, you're a professional. You interact in a professional environment all the time. So let's shift from the school scene to the workplace to the professional environment. Um, how do you manage? Now, we know you're resilient and we know you have confidence, but you probably go into situations where you have to let them know about your hearing loss. How do you do it? How do you maneuver a new situation with new people who might not understand your communication needs?
Yeah, sure. And Barbara, before I answer that question, you touched on something really important I wanted to weigh in on a little bit. So, what I did not recognize when I first received the hearing aids was I thought that once I had the hearing aids, that was it. I can hear well, I can hear perfectly. But then there are those situations where maybe I was in a board meeting or in a church where the acoustics is different. I often felt confused. Why am I struggling to understand, right? So just because I had hearing aids doesn't mean I could catch everything. And that's where I got to learn later that, things like hearing loops that transmit sound from a microphone directly to the hearing aid could help. And one other thing that I did experience was that once I got the hearing aid for the first time, I thought that was it. I did not realize that I needed to go in on an annual basis to check my hearing and the hearing aids. I didn't do that for a few years, and then I started struggling again understanding people, including in the workplace, talking about the professional setting. Eventually, when I went to the audiologist, I learned that the hearing loss had exceeded what the hearing aid could handle, and so I was struggling again with all of those challenges. So just one thing I wanted to mention there is the annual checkup, and that would really help. In the professional setting, what I have gotten to do that really helped me was, again, going back to it starts with you. It took a lot of weight and energy to stand up and advocate for myself. And I actually learned that term at HLAA convention, self-advocacy. What does it mean to advocate for yourself? What does it mean to ask for accessibility opportunities in
Well, Eve froze for a minute, and I know he's saying some really important things.
About
So
technology,
we'll wait for Eve to get back with us. Ivette, do you want to talk about advocating for yourself? And
Yeah,
well,
I mean, I think the key is that this could start from a very early age and it changes developmentally. But you know, a lot of what we've been talking about and something that I've been keeping in the back of my mind that I've been wanting to say is we have to normalize some of these feelings. Oftentimes, right, even I catch myself as a provider wanting something quicker than maybe the person in front of me is ready to do. And so I think that connection of realizing that this is tough. We realize this is tough. There might be changes, you know, and that's something that all my fellow panelists have mentioned of there's changes, there's differences, there's feelings of fear. All of that is normal, but just knowing that it's there and it's present, and then what is next, and finding the right people and the right team to support you is the most positive thing that you can do. I've seen I know we're supposed to be putting things in Q&As, but I see chats and all these comments coming up of find that right team. Find the people that are listening to what you want, your choice. This is about you and nobody can make the decision for you. There's providers that can help you get the information to make an informed decision. But all of these things of the right school placement, the right form of communication, the right group to, you know, connect with, that all is going to come from you, but you have to find the people that you feel that you're able to communicate openly with, to help guide you in that right direction.
That's a great point. And we have HLA chapters across the country, and we hear from people in chapters, you know, this is a place where it's okay not to hear well. And I can say that openly, and they find the mutual support, and they share tips, they share technology tips, they share coping tips, they have educational programs. So I encourage people, one of the resources is our chapters. But both to Allison and Ivette, and I sure hope Eve gets back with us. I know he was saying something great. People who want to seek some mental health support, whether a psychologist, a social worker, or a psychotherapist, how do they find one that's going to understand the nuances of living with hearing loss? Allison's laughing.
I'm laughing because it's very challenging. I think it's easier to find a therapist if you have a deaf identity and you know sign language. Just before we met today, there are a number of people, and by the way, I'm happy to provide my information, and I can. It's hard to find people directly. What you can do is check out Psychology Today, find a therapist, and then put in hearing loss or deafness. Chances are that somebody who's trained in deafness is going to have the ability to help you, but part of looking for a therapist or a counselor is advocating for yourself, and you're the one in charge, asking questions if they have experience working with people who are hard of hearing and don't know sign language. So many of the deaf therapists are deaf themselves, but there are also quite a few hearing therapists who are fluent in sign language, but they can also be familiar with people who have hearing loss as well.
Ivette, what could you add to that? What question, if I were going to seek a psychotherapist, what questions would I ask to make sure that that person could understand the nuances of my hearing loss while treating me?
Yeah, and I think, you know, it is very challenging. Unfortunately, there isn't a lot of training, like Allison was saying, that actually psychologists get specific to working with individuals who are deaf or hard of hearing. It does seem to be that there are some that are very focused on ASL and more deaf identity, but I struggle with finding individuals who understand hearing loss for those that are seeking more of different choices and want to seek technology or use other forms of communication. I think the best connection is, you know, first talk to your clinic. It might be that other individuals have asked, and so they start to put a list of local providers that, while they might not have 100% expertise, they have worked and collaborated with that. I has, talked to see if you go to a clinic or a larger hospital, sometimes they have those departments. So while they might not know exactly or haven't worked with it, they have direct communication maybe with the audiology team that could at least they could ask questions. I would also, talking about advocacy, and we're saying when you're ready to ask questions is, if you meet with a psychologist or a therapist, a social worker, and you don't feel your needs are being met, it's okay. Find another one. There's a list of providers. Look at your insurance card. If you have behavioral health, look at those. And if you do actually find somebody that you feel comfortable and has helped you in your journey, share that with your audiology team so that now you can help other individuals who might have those same questions. That is really the only way we're going to get better. I know some organizations are starting to put lists together. They're starting to have, special networking groups for individuals, working with individuals maybe with cochlear implants or hearing aids. And so we kind of all need to work together because unfortunately there isn't a great list that includes all, but I think we're starting to get in that right path.
Those are great
I wanna
suggestions.
I'm sorry, I want to add that in addition to that, the 4 top university medical centers that work with deaf and hard of hearing people are in Rochester, New York, Gallaudet in Washington, D.C., Cal State Northridge, and also University of Texas. And sometimes the universities will have also really good resources as well.
That's great.
The Wellness Center actually has more hearing therapists rather than just deaf therapists. So absolutely advocate for yourself. And then if you can't, it's important to ask, what is your experience working with people with disabilities? Because it would be nice to say what's your experience working with someone with hearing loss, but if not, then you're really looking for someone who can see you with your unique issues. Your hearing loss needs to be paid attention to as opposed to just kind of flip to the side as if you have diabetes and you're talking with your doctor helping you manage that. So
good suggestions, and not only the hearing loss issues, but the communication access in your sessions. You have to be able to hear and communicate is important. If you have a really enlightened mental health provider, you might point them to looking at the recordings of our Research Symposium from last year on the emotional side of hearing loss, tuning into this webinar, looking at our resources. I mean, it's really enlightening, I think. Eve, you were
Yes.
unluckily
welcome
cut
back.
off.
I tell you what, Barbara, we love technology so much. Sometimes it just fails and my computer decided to do its own thing. But we talked about resilience, right? That's what resilience
Absolutely.
is all about. And it also touches on the technologies that we use for hearing. So talking about the work setting, there was a time when I actually forgot my hearing. No, I did not charge my hearing aids fully. And so I had a meeting going into a meeting at work, and then the batteries died, right? How do we handle situations like that? So one of the things I have often did is if I know the meeting organizer, I usually ask, are there any pre-read materials they can send to me so I can read ahead to the agenda items. And then when I get into meetings, if it's virtual meeting, advocate for closed captioning and just everything, ask questions. Ask questions is one of the things that I struggled with in the past, asking someone to repeat what they said. I just, or pretending to understand that I heard what they said when that's not the case. And so just being very proactive, asking for, accessibility features, closed captioning, pre-read materials, if applicable, asking questions in the chat, in the meeting, and just also letting my colleagues know this is where I am. I'm experiencing hearing loss. The hearing aid helps me, but this is how they can communicate better with me, speak clearly speak slowly in a way that I can understand. And you know what? They support me. They've always been supportive, and they can support you too in the workplace.
And certainly because they want you to succeed, they want to succeed, and they want to be heard, right? So they want to
Yes.
make sure that they're communicating. We have really dug in today, and we're nearing the end. And I know there's so much more to talk about, but I would like to go around the room, and I'm going to say, if there was one thing that listeners could take away today, one piece of advice, what would you give to them? I think I will start with Dr. Ivette Cejas, who's at the top of my screen. What one thing could you say? I know it's hard to say one.
Yeah, that's a tough one. The one thing I would say is give yourself grace. We are all human. We all have feelings, and it's okay to accept them and realize at the same time that you could grow and change in that process. While we all have our ways, change is possible. And sometimes you just need help to get you on that right journey. So give yourself grace, applaud yourself, and just accept the fact that this might be part of who you are, but also makes you the beautiful person that you are. And so thank you for this wonderful opportunity to be part of this panel.
And I like the part, makes you part of the beautiful person you are, because that takes the negative to the positive. And if you can do that, you're one step ahead. Dr. Allison Friedman, what would you like to say?
I echo what Ivette said. I think that recognizing that you are not defined by your hearing loss, the need for self-advocacy is extremely important and will be with you throughout your journey, throughout your life. Even today, many, many years later, I'm constantly learning about how to advocate for myself better, from being a very passive, young girl who's afraid to do anything, to being able to be outspoken, and I'm still learning. So give yourself, like you said, the pat on the back for constantly trying to be the best you can be. And when you know better, you'll be able to do it better. But for the meantime, accept what you are.
And I think you're saying that when you learn to advocate for yourself, you become more confident who you are and maybe more at peace with living with hearing loss.
Yeah, absolutely.
That's
Yeah.
great advice. Eve, why don't we get your final thoughts on what's a takeaway that you would like to leave with our listeners?
Yeah, I would say it's okay to ask for support. Support played a key role. I know you talked about resilience, but there was a time when I felt I could not get back up. I felt depleted emotionally. And the one person who really got to understand what I was going through was my wife, Joy. And because she had known me for so long, she saw how driven I was. And once I got the diagnosis, it was going downhill. And she was one person who never gave up on me. She supported me through the journey. She encouraged me through the journey. And then later on, discovering the HLAA, that was the biggest discovery that really transformed my life and gave me hope, knowing I was not alone and knowing that I could ask anyone within the HLAA community for help. I could be in the Facebook group and hear other stories like mine and know that I'm not alone and know that I could ask questions and people are willing to provide the feedback, the support to help in the journey. And also seeing the support from my kids. They're not just little kids. They get to understand it all depends on how we educate them. And to see the response that I got from them, the compassion and the love that they showed, all of those things helped me. Those support that I got from this community and from the people, it really transformed my life and helped me to be who I am again today.
That's beautiful. And I love that your wife's name is Joy,
Yes.
because I can feel the joy coming through you, Eve.
I often say that God really used her to turn my sorrows into joy because I was at a very low moment and I did not see myself getting back up. And my story is truly a testimony for anyone feeling that you can never get back up. I want to assure you, and I want you to believe in yourself that sure enough, you can get back up.
I think that's a wonderful punctuation, exclamation point at the end of our session. Thank you all, the panelists. You've been terrific. I'm going to turn it back to Robin, and she's going to go over some of the resources. This was recorded today, so you'll be able to watch it again. Robin.
Thank you, Barbara. And thank you to all of our panelists so much for taking the time to shed some light on this topic today. Thank you to all of our participants for joining. All registrants will get a follow-up evaluation and a link to the video recording of this webinar soon. We'd love to get your feedback through this quick survey. In the meantime, check out our resources on the emotional side of hearing loss at hearingloss.org/beyondyourears, or you can scan the QR code on the right on your screen. Also, make sure you sign up for HLAA news and updates at hearingloss.org/news-alerts, or you can scan the QR code on the right. You'll get alerts to hear about all our educational and advocacy opportunities. Thank you all so much again for tuning in to this HLAA webinar, and have a great rest of your day.